Hi, my name is Megan Walschlager, and today I'll be presenting on hyperlordosis. There are several misalignments that can occur in the spine. We'll be discussing hyperlordosis. Hyperlordosis is the overarching of the lumbar region of the spine. To better understand what this means, let's briefly go over the basic structure of the human spine. The spinal column consists of the spinal cord, which runs through 24 articulating vertebrae. These vertebrae are divided into three regions: cervical, thoracic, and lumbar. The cervical regions consist of 7 vertebrae, the thoracic 12, and the lumbar region 5. A healthy spine has a natural kyphotic curve in the thoracic region and a natural lordotic curve in the cervical and lumbar regions. As I said before, today we'll be discussing and focusing on the extreme curvature that can occur in the lumbar region, hyperlordosis. This condition is more commonly known as swayback and is quite common in dancers. Shown here are common spinal misalignments in comparison to the normal spine. You have scoliosis, which is a side-to-side curve, kyphosis, which is a misalignment in the thoracic region, and lordosis, which is a misalignment in the lumbar region. Unlike other spinal misalignments, such as scoliosis or kyphosis, lumbar hyperlordosis is not a fixed condition and can be reversed. Some basic fixes for hyperlordosis are stretching the lower back, hip flexors, and hamstrings, and strengthening the abdominal muscles. All of these exercises help correct the anterior tilt of the pelvis that occurs in dancers with hyperlordosis. More flexible hip flexors, hamstrings, and lower back and stronger abdominal muscles help to properly align the pelvis in a neutral position. Anatomic factors that may contribute to the forming of hyperlordosis are thoracic kyphosis, weak psoas muscles, tight hip flexors, femoral anteversion, weak abdominal muscles, tight lumbar fascia, tight hamstrings, and hyperextended knees. Though hyperlordosis is a serious condition, the prognosis of recovery for a dancer is quite positive. Every dancer desires to dance at their best ability for as long as possible. Though hyperlordosis may put a bump in this plan, it can be smoothed out by receiving treatment like the previously explained exercises. Very rarely does a dancer have to have surgery solely because of their hyperlordosis. The rare occurrences of this surgery occur because dancers herniate a disc because of their hyperlordosis. For a dancer to live with this condition in a healthy way, they must continue the exercises after symptoms relieve. I hope you now have a better understanding of hyperlordosis and its effects on the body and a dancer. Thanks and gig 'em.